Good morning, good afternoon, everyone. My name is Andries Gontshwanetse from Botswana. Together with Mrs. Baredi Winnie Mantswe and Dr. Memi Gichise. So we're presenting on the Botswana Hemophilia Champion Model. Can go to the next slide. So the reason why we created this model to run with, it was to address some few problems. One of the problems was that hemophilia care was mainly centered in Princess Marina Hospital, that is the tertiary referral hospital based in the capital city in Gaborone. And looking into the vastness of our area, we realized that we need to try and decentralize the services. So this was increasing the burden on one facility. And that means they had to share the resources, the small resources that the hospital had. And one other problem was fewer clinicians were aware of the hemophilia, as this is not widely covered in our training curriculum and tertiary, be it for nurses, doctors, pharmacists, and other clinicians. So that's why we found it worth to come up with this model. So the fact that this is not widely covered in our curriculum, it leads to underdiagnosis and lack of continuity of care. So one other thing was the capacity building of the healthcare workers. We found that it was needed, hence we created this model. So let's go to the next page. So looking at the why of why did we create this model? We created this model to create a pool of trainers. We didn't want to be the only people who are able to train. So we trained people who are going to be trainers. And we also wanted to expand access to hemophilia care across the country. Remember I said at first it was just centralized in one place. And we also wanted to enhance timely referral for improved diagnosis and care and management. You can imagine if someone have to travel 1,000 kilometers to meet a doctor or a nurse who is experienced in hemophilia care. Next slide. So looking in the how part of this model, so we developed a curriculum. This was a 2 weeks training. We had clinicians coming from all over the country to come and land under one roof. So our curriculum, it had a different kind of way of learning. We had lectures, we had practical sessions, we had didactics, we also had demonstrations, role play, and others. So we did identify interested and committed healthcare workers by way of advertising, and those who were interested, they applied, and then we selected the few eligible ones. Those are the ones that we call them and to come and attend the training. So by having them, by us releasing a call for expression of interest, we didn't want the old model that we used to use here, where you just send a letter to a hospital to say, give us someone, and you don't know if that person is interested in this. Yeah, so we also had a buy-in from district health management teams These are the headship of different health teams in our different districts. We made sure that we explain to them what we are doing, so that after training, these people can be able to cascade the information without any problem. Next slide. So one might ask, what were we looking at? So we did 2 trainings. The other one was in November 2019, and the other one was in February 2020. So like I said, it was a didactic and practical session. We had some clinical visits. We had live patients. We also used the trainers, and we also had different lectures. You will appreciate that some of the clinicians, like experienced doctors, they had never seen a hemophilia patient before. They saw them first in this training. So that was very interesting. And we did facilitation by representatives from different departments within and outside Princess Marina Hospital and Botswana Baylor, including Texas Children's Hospital and Scottish Livingston Hospital. So some trainers, we had them via Zoom. They did the training via Zoom, and some were outside the country, some were within the country, and it was a multidisciplinary approach. Next slide. So we had very beautiful results from this model. We managed to train 18, we managed to train, from this model, we had 18 training workshops conducted by hemophilia champions. So this 20 clinicians that we trained, they went out and started conducting workshops in their respective areas. So, and out of those trainings, we managed to have 295 healthcare workers trained. I need to appreciate that within that short space of time that we had, Dr. Chise, me, and Winnie wouldn't have managed to reach those areas and do training for so many people, looking at the fact that we've got other primary duties that we are doing. So we managed to cover 17 healthcare facilities, and that is in different district health management teams. Some of these areas, they are more than 1,000 kilometers far from where we are. So this model really helped us. We also had brochures that were translated in our native language and some were in English. Through this champions, we managed to distribute 2,036 hemophilia brochures around the country. That is for patients to read. Next slide. So here is our beautiful testimonies from hemophilia champions. We had one saying this project has empowered us as healthcare workers to do our job better. It has made us aware of hemophilia and bleeding disorder. It has provided funding for other facilities in terms of equipment and booklets. And another one said the project covered most districts on training of hemophilia, which is not known much by many. Hence, more people will be sensitized on hemophilia, hence proper and early diagnosis and treatment, that is management of hemophilia. The trained people will train other people, hence more awareness on hemophilia. So we saw all these pledges coming into pass. The champions are on fire and are all out to cascade the information they have learned. Next slide. So that was a WhatsApp status we captured from one of the champions. He said, that moment you knock off after exactly 13 continued hours of no break in between, but somehow happy about it and feeling fulfilled just because, wow. I think I like missing. Waiti, it means truly in Setswana. I mean, nothing fulfills like knowing you saved one day and made impact. Forever grateful for to NNHF. So this was a nurse who is in a remote area who came for training, and a patient came with some complication, and she managed to apply the skills she learned from the champion model during the training. And she was so fulfilled that I didn't manage to help a patient that I couldn't help before the training. Next slide. So some of the challenges we experienced, it was limited time to cover more places. Since the same staff had to do other clinical duties. We have other clinical roles, so we had to squeeze the schedule into our tight schedule. We had limitation in resources such as high quality camera. I think the NNHF team will appreciate that we kept on sending blurred pictures because we had to get them by our phone. And we had COVID restrictions also. Social distance limited us in terms of capacity. We couldn't train more people at the same time because we had to do social distance. And we had lockdowns that resulted in frequent changes in schedule and some lags in communications. But nonetheless, we did the best we could. Next slide. So that is a beautiful picture in one of the training we did in Khansi. So it was organized by one of our hemophilia champions, and we went to support that champion. So that is that. If there's question and answers, I will leave it to you, Sarah. Thank you.